Hey, this is Dr. Johnson Terry, family physician with over 20 years of clinical experience and author of Lies My Doctor Told Me. For the next few minutes, I want to discuss leg cramps, 7 causes and 7 cures. Millions of people suffer from leg cramps, some rarely, some almost every day. You can help yourself, your friends, and your family by learning about this and sharing the information. Many people think leg cramps are just part of life, but it doesn't have to be that way. I'll list the 7 causes in order from most common to least common. The most common is not very dangerous, while the least common can be very serious. So you'll want to pay attention through the end. Number 1, by far the most common cause, is not getting enough salt in your diet. For decades, we were told salt is harmful and should be restricted, but research does not support this. All mammals, including humans, need salt daily. Use real, unprocessed salt from ancient sources, not modern oceans that may contain microplastics. Number 2 is electrolyte imbalance, especially low magnesium, potassium, and calcium, along with inadequate arachidonic acid. Most people today are deficient in magnesium and potassium. Good sources include leafy greens, nuts, and certain fish like sardines or anchovies where you eat the bones for calcium. Arachidonic acid, found in fatty meats and seafood, helps calcium enter muscle cells so they can contract and relax properly. Number 3 is temporary overexertion. If you are mostly sedentary and suddenly take on strenuous activity, like a long hike, your leg muscles may cramp for a few days. This is normal and not dangerous, and it usually resolves with rest. The solution is to stay active more consistently. Number 4 is medications. Statins like Lipitor, Crestor, or Zocor are notorious for causing muscle pain and cramps. Other drugs that may contribute include osteoporosis medications, Forteo, Evista, synthetic estrogens, NSAIDs like ibuprofen or naproxen, calcium channel blockers such as Norvasc, antihistamines like Zyrtec, certain antibiotics like ciprofloxacin, and SSRIs like Celexa. If you suspect your cramps are related to medication, discuss alternatives with your doctor. Number 5 is a blood clot in the leg, called DVT. This usually affects one leg, causing cramping that worsens with walking. This can be serious and requires immediate medical evaluation with a venous Doppler ultrasound. Number 6 is blocked arteries in the legs, also known as peripheral artery disease. This can cause pain and cramping, especially with walking, and is more common in people with diabetes, high blood pressure, or a history of smoking. Tests like an ankle brachial index or vascular ultrasound can confirm this, and sometimes treatment requires stents or bypass surgery. Number 7, the rarest but most serious cause, includes cancer, autoimmune disease, liver disease like cirrhosis or lumbar stenosis. These conditions can interfere with electrolytes, nerve signals, or circulation and require thorough medical evaluation. If you have persistent or unexplained cramps after addressing the more common causes, see your doctor for further investigation. These are the 7 main causes of leg cramps and the 7 corresponding interventions. 1. Not enough salt. Increase intake of real, unprocessed salt from ancient sources. 2. Electrolyte deficiencies, magnesium, potassium, calcium, arachidonic acid. Eat foods rich in these nutrients like leafy greens, nuts, fish with bones, fatty meat, and seafood. Consider supplements or electrolyte drops if needed. 3. Temporary overexertion. Maintain regular physical activity, stretching, and muscle strengthening to reduce the risk of cramps. 4. Medications causing cramps. Consult your doctor about adjusting dosage or switching medications, statins, NSAIDs, calcium channel blockers, certain antibiotics, SSRIs. 5. Blood clot in the leg, DVT. Seek urgent medical attention if cramps occur in one leg, for proper diagnosis and treatment. 6. Blocked arteries, peripheral artery disease. See a doctor for circulation tests, and if necessary, treatment with stents or bypass surgery. 7. Rare but serious causes, cancer, autoimmune diseases, liver disease, lumbar stenosis, thorough medical evaluation, and treatment of the underlying condition.